Good morning, everyone. It's still warm outside, so enjoy it. I don't think it's going to be like that tomorrow or the day after. My name is Ndwale Jolly, and I have the pleasure of serving as the president and CEO of the St. Louis Integrated Health Network. And I am honored and grateful to be here with you all today at the Group Prenatal Care Additional Reimbursement launch event. And today is a celebration of partnership to advance positive health outcomes for moms, babies, and families across the state, and to drive statewide policy change to make sure we have a healthy Missouri. I'm the father of three, an 11-year-old, a 7-year-old, and a 5. And every morning before I get here, I've had a full day. For those who are parents, they understand what that means. And they were all born prematurely. My son was a 28-weeker. My daughter was a 31 and a 33. So I'm a resident of St. Louis Children's NICU, and I paid them a lot of rent. Thank you to the Affinia Healthcare family. I don't see Dr. Holmes here, but I send her my regards, Dr. Tapey. Thank you as well as the whole healthcare team at Affinia for your contribution in this effort. And we also appreciate our collaboration with Mo HealthNet, Mr. Kirk Matthews, Abby Barker, and many others on their team who are here today. Dr. Heidi Miller as well over there. How you doing, Dr. Heidi? For your contributions and understand the impact of group prenatal care and how it helps further positive health outcomes for moms and babies across the state. And we look forward to continuing our work together as we work to increase access for patients and to drive policy and sustain meaningful change in our region. I also want to thank Kelly McKay, our director at IHN, for all her contributions to this effort as well. And for those who may not know, IHN is a healthcare intermediary working to build partnerships and working across sectors to advance health equity and well-being for patients in historically excluded communities. And in a moment, you'll hear about one of our initiatives, the Elevate Collaborative, and our collaborators, Dr. Melissa Tapey and Sharon and Rochelle, who are over here. And understand our fight in order to improve mental and emotional and physical well-being for birthing individuals, especially Black women, who are most impacted by disparities. In that effort, we hope to continue to work with you all of our partners in this room, to drive further change in prenatal care through group prenatal advanced additional reimbursement for group prenatal care, in order to reduce preterm birth rates for Black women and all women across the state. And finally, I want to thank our partners in the room, Affinia Healthcare, BJH, SSM, St. Mary's, Healthy Blue, Family Care, and St. Louis University School of Medicine. And though we all have more work to do, today is an opportunity for us to just share and learn and celebrate the journey we've made so far and the fight we have to continue in order to make sure we have a healthy state and region for everyone who wants to build their families. So thank you for being here this morning. Thank you for celebrating with us. And I welcome Mr. Kirk Matthews up to the stage for his remarks.
This will do it, pal.
Yeah, put that on my collar here. Will that work?
Yeah, perfect.
Thank you, Ndwale. I really sincerely appreciate the opportunity to be here today, and I appreciate the invitation from Integrated Health Network and Affinia Health. And my message is brief, but I just want to. There's a lot of gratitude in our department for what's transpiring, and I would say about 15 months ago or so, our Mo HealthNet director Todd Richardson really launched an effort in the entire maternal infant health space. When we look at the numbers, we know there was opportunity for a lot of improvement. And it was about that same time that Dr. Abigail Barker, who is on my team, in case you don't know, I lead what is called the Office of Medicaid Transformation, a relatively new office that Director Richardson created when he realized that as busy as our operating units are at Mo HealthNet, the opportunity for real and lasting and meaningful change was not going to happen without sort of an internal change agent. And so we have a very small team. There are 5 of us in the Office of Transformation, and we are not bound by the we've always done it that way thinking, and we're not responsible to keep the trains running on time like our operating units are. So we get to think outside the box. And then the operating units, it's been really a remarkable kind of a culture shift at MoHealthNet, that the operating units, we found many of which are saying, we've been longing for these changes and these ideas, and we just didn't have the time or the resources to put them into play. So about that same time, Dr. Abigail Barker elevated the idea of group prenatal care, pun intended. And she made me aware of the work of Dr. Ebony Carter, and we began to study that. And so I'm really happy today to participate in the celebration and the announcement and sort of the launch of this initiative. And we have high hopes that it will move us down the path of eliminating racial disparities in our maternal infant health outcomes, which we know exist. There are also geographic disparities. Our rural moms struggle. And I want you to know that this effort that Director Richardson launched about 15 months ago or so, we have about 50 to 60 of our staff at MoHealthNet meeting weekly to address a host of initiatives, maybe a couple of dozen different initiatives focused directly on maternal infant health outcomes. And so we've already seen, with the help of our legislature, the extension of our postpartum care to a full 12 months, which, and we really believe and hope that these initiatives, when they begin to stack, will have an additive, a cumulative effect as like a snowball rolling downhill to help address some of these outcomes. There's still a lot of work to do. There are still plenty of initiatives to come that you'll be hearing about in future days. Dr. Heidi Miller's here from the Department of Health, and they have an initiative going, and for the first time really in a long, maybe ever, but certainly in my tenure in state government, we have agencies that are actually communicating across lines, and Heidi's put together a collaborative around maternal infant health. And so there's just a lot of good things. We're looking at how we can incorporate more what I call non-traditional providers to help provide care in non-traditional settings, like the doulas and culturally appropriate doulas and the impact that they can have. And how can we better deploy community health workers? And Missouri Medicaid doesn't have a lot of levers. Most of our levers are in the payment line. How can we pay for these things? And there's a lot of active work going on in all these areas. So again, on behalf of MoHealthNet and Director Todd Richardson, thank you for all the work that's represented in this room to help bring this about. And we look forward for more to come. Thank you. Oh, sorry, I stole the microphone.
You can keep going from back there. All right. I'll put it over here. All right. Well, good morning, everyone. Thank you, Andwali. Thank you all for coming. Thank you, Kirk. Thank you, Amanda and Anna. Where are you? I'm finding you. Thank you. Thank you, MoHealthNet, for sponsoring not only this launch event, but this programming and this support for group prenatal care, and most importantly for Missouri moms, pregnant people, and their families. My name is Dr. Melissa Tapey. I have the real privilege to be the Chief Medical Officer and Vice President here at Affinia Healthcare. And it's really my honor to be an OBGYN. Helping people through pregnancy and birth really, in my opinion, is one of those miracles that I get to be a part of, and I'm honored to do so. And so I also have patients, right, and other champions of group prenatal care here in the room. So I'm just going to ask each of you to stand and just introduce yourself quickly, and they'll be part of the presentation as well.
Hello, my name is Tiara Briscoe Jackson. I'm a patient of Affinia Sister, and my children are as well.
Thank you.
My name is Sharon Phillips, and I've been here since the inception of Elevate.
My name is Rochelle Smith. I've also been here since the inception of Elevate. When I was pregnant with my first child, I participated in the group prenatal care program.
Thank you, guys. And they will be participating in this as we move along. So a little background, which has been alluded to, right? We know that health outcomes for pregnant people are not great, right, across the nation, but not here in Missouri as well. And we're all here because we think that is unacceptable, right? That is just simply unacceptable. And we want to use all the tools in our toolbox. We want to think outside of the box, right, for new tools, and we want to support each other at various levels to make sure that we can improve those outcomes. What's listed up here are some items, right, that put people at risk for worse outcomes, right? At risk for perinatal death related to their pregnancy. If you have a lower education status, if you have Medicaid, right? So very important to have these partners in the room. If you are a Black woman, and that's not acceptable. We should not be able to look across categories of people and see disparities in outcome. And so we need to focus our efforts to take away that burden, because that's not all about personal choice. In fact, mostly that's about systems and how we support people in life and in pregnancy, because pregnancy is kind of like a stress test, right? You put a woman, a person, a family through a pregnancy and a birth and the postpartum period, and it is a stress test on what your social and economic situation looks like. All right, so group care. What is group care? Why are we here today? So group care is like it states, right? You are looking for a group of about 8 to 12 pregnant people around the same gestational age, right? Time in pregnancy. And their prenatal visits, instead of being one-on-one, right, with their physician or clinician the entire time, is in their group. So their group includes other pregnant people, support people, their clinician, right, which can be their midwife, their nurse practitioner, their obstetrician. And generally speaking, you're in a cadence, right, every month, every 2 weeks. These are your visits. You come into that space. You get to know these people. You are educated. You take your own blood pressure. You take your own weight. You have a little bit of private time off on the side, right, with your clinician to talk about some private things. Listen to the baby's heartbeat, measure your belly when that's appropriate, right? And then you come into this group space that should be safe and full of sharing, right? You may do an icebreaker, other activities to get to learn about each other in the room. And then there are also activities that kind of enhance, right, and move the educational piece forward, or what we might be talking about today. And it really gives us the time, because a total group time can be up to 2 hours. It gives us the time to really do a deeper dive into some of these topics that maybe I don't get to in an individual visit, right? Intimate partner violence, mental health supports, right? What are our real challenges in life? Different positioning and comfort care during labor, infant care, things we touch on in individual care that's traditional, but we don't always get that in-depth opportunity. And so, you know, here at Affinia, we've been supporting group prenatal care, and I'm going to give a shout out because she's here in the audience. Becky Hassler, midwife extraordinaire, right? Started group prenatal care here at Affinia in 2008. So I am a product of that when I joined in 2009. And administratively, we support group prenatal care because it's the right thing to do. We form relationships, not just between healthcare team and patient, but the patients themselves. There's a wealth of knowledge and experience in that room, and experiences that I may not have had in my life that they can share with each other and that I can learn. And if I have some individual biases, right, that I may or may not be aware of, that time and that education helps to break down those barriers as well. So, and also the outcomes. Right? Research has shown that group prenatal care is at least as high quality as traditional care, right? Some studies show that it lowers preterm birth rates, that it improves outcomes. And research has shown, and specifically our regional pilot has shown, that outcomes are better for Black women specifically. And as you heard, Black women have a higher burden. So we need to focus and listen to them. So with group prenatal care, what we've seen is a decrease in preterm birth, an increase in mental health, so better scores and better improved outcomes for mental health. And for Missouri, mental health is the number one, right? The number one cause of maternal death in Missouri is mental health care. So if we can change some of that, all for the better. So outcomes preterm birth, mental health, and breastfeeding also improved with group care. Why did I choose to do this as a clinician? Well, because Becky told me. No. I did have some experience actually with this in medical school, but really group care allows you, even as a clinician, to be a different type of clinician. I get to listen. I get to actively learn, right? I get to change maybe my thought process of what traditional care needs to look like. I get to learn to think outside of the box and what is possible. And what I've also seen over time is not only has it changed me and not only do I enjoy it, but patients that I had in group care still ask about each other. We're talking 10 years later. They still ask, how is so-and-so doing? You know, like that is a bond that forms, and it's really a beautiful thing. So with that, I am going to hand it over to Sharon. And, oh, is it Rochelle? I'm sorry, I went out of order. Rochelle, thank you, Rochelle. And Tiara, to give a little bit about your experience. Rochelle, if you want to start.
Thank you. I have buttons today. This works. Hi, again, my name's Rochelle. I did participate in a group prenatal program 7 years ago when I was pregnant with my firstborn child. The reason why I chose to do it was because I went with my sister to her prenatal care appointments when she was pregnant with my nephew, and it was extraordinarily boring, and I was like, yeah. Something different, of course, I'll take it, and I do like being around people. I like interacting with other people, and then they said they had snacks, so again, I was sold. So like going there, the experience for me was really, really enlightening because being around other people who are along the same gestational period as you, like Dr. Tapey said, we got to bond, we got to interact a lot. I vividly remember this moment that we were all sitting around in the circle, and we were around that, I want to say 16-week mark, and like a few of us like jumped and we looked at each other like, oh, your baby's kicking too. And it was so really cool to like bond like that, to know that like, wow, we're really experiencing a lot of similarities together, and we get to share those moments with each other. And it was just, honestly, it was like a pivotal moment for me. I also really appreciate the fact that we had a doula, because prior to that, I did not know what a doula was. I had never experienced being around a doula. I wasn't really sure what type of services existed for them, but we had a doula, and I will never forget her. Her name's Kelly, and she was a Black woman who told me that she gave birth to all of her children being induced in without an epidural, and that was my goal, and I was really, really scared to do it, but she empowered me to know, like, hey, you can do this, you're meant for this. So when I gave birth to my daughter, I did get induced because I was overdue. She didn't want to come out. She's stubborn like her dad. But I did get induced, and I went to the hospital, and I advocated for myself, because that's something else I learned to do in group prenatal care, was advocate for myself, to say like, hey, you're a professional and you have all this understanding, but I know me and I know what I need, and I can advocate for that. And I did it, and I was, it was really like a growing moment for me. Group prenatal care is also the reason that I'm the only person in my entire family who has ever breastfed my child, and I did it for 18 long months. But it really empowered me to know that I could do it, and that I was capable of doing it. And even if no one before me did it, no one before me did a natural birth, no one before me ever nursed that child, they did it. They didn't do it, and group prenatal care taught me that I can. And that's why I continue to advocate for it, because it could help someone who doesn't have that prior experience and that prior community around them to know that, like, hey, you could be the first, you can do it if you really have it in your heart to do it. There's a group of people that will support you in doing that. Thank you. And then I'll hand it over to Tia to share her experiences as well.
Sorry, y'all, I'm a bit nervous, but oh Lord. Okay, so the main reason I participated in Elevate was because, oh my God, I'm so nervous, I'm sorry. I love the fact that it was a group setting and everything. We all got to feel comfortable. I've never participated in a group setting where we all was able to talk about our pregnancies. And I like the fact that my Lord Jesus, my OBGYN was there, and she was so knowledgeable. And whenever we had questions, we was able to answer it. And like, I forgot your name. I'm sorry.
No,
Dr. Tapey, as she mentioned that, like, there were moms that we all were around the same birth Yeah. I'm nervous, so I'm scrambling. I'm sorry. We were all around the same gestational age, I guess that's what it's called. And we can all relate to each other. It was funny how we'll all be able to speak on like our pregnancies, how they were all similar, different. Whenever we had questions, we was able to ask. Like she said, we had a doula. We were able to bring our children. That's what I love, because my children is always with me outside of work. And we was just able to learn from each other. We always did like exercises as far as like learning from the different aspects of pregnancy, because a lot of times we don't have postpartum resources and stuff. So we spoke on every aspect of pregnancy, and I love that. And we was able to be comfortable and actually speak on topics that you wouldn't feel comfortable with your regular doctor. And some things like I've nursed my last 2 children, and the last one was up to like 3 years almost. And a lot of moms there, they wasn't really nursing or breastfeeding, so I'm glad that I was able to actually help them out and give them different tips and, you know, just more information on it. So Elevate was just awesome. I had to make time today to come. I was so honored to be a part of it that I just wanted to. And I don't know what else to say. You all put a lot. Oh, see, I forgot I had it
That's all
on.
right. We appreciate you taking the time. It seems you are an essential employee. Yes. Thank you both. I think that's more powerful than an OBGYN sitting up here and talking, actually. And just to, again, the support through Medicaid for this program is super important. You've heard here how it can change lives and how it's meaningful as well to the healthcare team, right? I think everyone agrees with that. And we're not here to take away choice, right? Group care is for all people, and traditional care is okay too, right? We want people to have the choice in how they want to engage with the healthcare system and have the best outcomes for themselves. So I also think that's important. And generally speaking, in group care, we do encourage, right, support people or your doula or your child, if need be, to come, because that's real life. And we want you to not only advocate, but for your support people to be able to advocate for you as well. So super important here. It's not a chemistry table. It's actually the map of the United States, right, with squares, and which states promote, like specifically have systems to promote group care or do not have anything specific in place to promote group care. So Missouri was one of 16 states with nothing in place to promote group prenatal care. And now we are one of 8, the green states. Yay! Woo-hoo! We are one of 8 states to have specific programs and systems to support group prenatal care. And that is so important for sustainability. For those of us that have been doing it a while, right, it'll help us sustain that programming because there is extra organization and admin time that goes into group care. And for those places interested in starting, it gives them a better chance to start and to see that sustainability picture, right? Again, just as you were talking about, Kirk, right? When you start to align the operations with the support of the state and the reimbursement funding, it's super important and it's really, really powerful. This is another tool in our toolbox so that we can help Missouri women, birthing people, and families. And I'm going to ask Sharon to come on up and lead us out. Oh, wait, let me see. Oh, yes. Oh, I got the one more slide, sorry. But you can stay up. It's super, stay up here because it's super short. So we want you to know this is being recorded, right? And there will be a billing webinar, right? Like how to actually get this to work in your space. So there'll be a billing webinar and it's February 1st. There's also billing handouts and information out in the hall, all right? And with that, I'll hand it over to you.
Okay.
Thank you, Sharon.
Put this thing. All right. Well, hello, everyone. All right. Well, the reason why I chose group prenatal care is because I feel like it seemed to be a perfect time in my life. I actually already had a child 10 years prior. And having a baby at the at that time was totally different at the same hospital, but it was a totally different experience. I was offered opportunity to go into group prenatal care, and I thought, man, this is totally different. I didn't have this at first, because at first all I had was this book. It was about this thick, and it was called What to Expect When Expecting. And that's all that I had, and I was going through it, reading and studying and comparing and everything. And this was something different where I actually get to talk to someone and ask questions and be around other people that had relatable situations. I was stressed about having a baby 10 years later, and so I felt like I need to be in therapy, and this was the closest thing to it was the closest thing to therapy that I could actually think of, and it was free, and it was coming with my Medicaid. I was like, let's do it, let's try it. And I took the chance, and I was able to bring my partner with me, and that was amazing because we were a very, very new couple. We hardly knew each other, but you're coming because we need to figure this out. And we were learning each other, and there they brought up a lot of topics, and one of them was like family traditions. We hadn't got a chance to talk about family traditions. Are we gonna whoop our kids? Are we gonna celebrate Christmas? And we hadn't got there, you know. And this was like happening all really fast. And I appreciate him coming and then being in there with other mothers who were able to bring their partners and their support people, because the guys got to bond a little bit and they got to connect and talking about 2K and the video game, and everybody was just trading off information, and it seemed like we are becoming a family, you know. It was happening. And so it helped to like smooth out a lot of the rough spots, you know, that we were about to come, that were on the way, and the ones that we had already gotten over. And so that's why I came, because I was looking for a new way. The first time I had a baby, it was like cool, go to the doctor, it was quick. But this time it was patient. I got to spill, I got to cry, I got to, you know, I got to bond, and I thought I had a really great time during that pregnancy, being able to be around all the moms and even having to ask questions to the doctor, because sometimes you don't get enough time to ask all the questions that you need. So I was just excited about that opportunity. But I want to give and of course, I want to say this, and I know Rochelle mentioned it, but the snacks, okay, just want to say that. For the future moms, make sure you guys have good snacks. Okay. But a big thank you that goes out to the Elevate team. We're excited to work across the disciplines and institutions to implement the group prenatal care all across Missouri. I am so excited. Starting off in a small room to now everybody being able to have access to this is like, whew, I feel like I feel more comfortable with Black women going into medical spaces without me or somebody else that I've actually got to lay eyes on and say, I know she's a good person, I know he's a good person, when you go behind the curtain and we're not there to protect you, you know. Knowing that they've been able to go through this program says that they can now advocate for themselves. So a big thank you to Elevate for that. Elevate works with patients, the healthcare teams, and at the healthcare system level to address advanced positive outcomes for the patients. We try to reduce inequitable adverse perinatal outcomes through prenatal group care, and provide intensive training for the healthcare teams and the communities to support the patients who are experiencing trauma, depression, and psychosocial stress as a result of racism. And want to say that with my chest, only because it's important to say that. Because again, like I said, I can't be in all the rooms with you, you know, once you go behind the curtain. That's the scariest part. And so I need to know that you know how to advocate for yourself and teach your family and support people how to advocate for you. Also, to increase the shared accountability between the communities and the healthcare teams through the development of innovative solutions, policies, and new approaches to the healthcare and delivery. So thanks again for Elevate's funders, Missouri Foundation for Health, Healthy Blue, and National Institute of Medical Health. And I want to thank you all so much for being here today. We have some contact information. You can reach out to us, ask us any questions. I'll be happy to answer anything. I'm pretty straightforward. If you don't see that now. So whatever you got any questions or anything, feel free. Dr. Tapey, Rochelle, and myself. All right. Thank you so much. Oh, and shout out to Kelly McKay, because if it wasn't for Kelly. Oh, microphone.
Well, they may have any questions.
I don't know if I have all the answers, but if there are questions here at the end, I'm happy to take them or send them off to friends if they're more appropriate to answer.
What is the cadence of these, the Elevate groups?
The Elevate groups.
And then how many different groups do you have, or sessions do you have to handle when they're different gestational groups, or do you go by trimester?
So the groups, I will repeat, yes, sorry, thank you. I'll repeat the question. Kind of what's the cadence of the group prenatal care, and how many visits were there, and
How do you group them?
how we group them?
Trimester,
So we try to group by gestational age, so how far along you are in the pregnancy, right? So we'd like women who are all kind of within a month of each other for their due date, right? And so we start at the beginning, and usually everyone gets an individual kind of first prenatal visit, right? Because that's really in-depth. We ask a lot of questions, there's a lot of history taking, exam, labs, things like that. And then if you want to do group, then group will start. Okay, and so the group cadence really is every month for the first, say, 4 or 5 months, right? And then you start getting every 2 weeks until delivery. And for those that deliver and there's still another group left, right, that's a postpartum group. Come on in and bring your baby. It's a celebration, right? And then typically each group will have some type of educational like curriculum or an idea of what we want to talk about. That way, there's nutrition and birth control and family traditions and mental health care and laboring techniques and postpartum and breastfeeding. Now, we also listen to the group. So sometimes that doesn't always stick with the schedule, right? Because one group may need to talk about something more than another group. But there is kind of a general curriculum. Did I get to most of those questions? Yeah.
No, this is, again, wonderful presentation to all of you. And for those who are thinking about launching group prenatal care, in the context of Elevate, how you've worked with not just the birthing individuals, could you tell us a bit more how you work with the providers to make the care even more optimal?
Yes, so with the Elevate initiative, the patients have been a central part to adding their voice and to ensuring that what they would want to see in prenatal care, right, comes through in our group care. But on the healthcare system, or on the provider side, the team side, the medical assistants and the nurses, we also go through specific training, not only on group care and how to facilitate, but on bias, on anti-racism principles. For most of us, right, we are taking care of majority Black women. That is important. I wish we had the right complement, right, so that everyone could go to a clinician that looks like them or has similar experiences. That is not where we're at yet. That is a whole pipeline initiative that we'll work on as well, right? But we need to find that shared experiences, right? We need to be able to find those mirrors. We need to work on our anti-racism principles, and we need to work on our own biases. So they all go through that training. Yeah.
Oh, sorry. To that, did it improve the outcomes for just Black women, or did you see changes for all women?
So in the general research, there are some studies that show high quality kind of with traditional care, and others that show improved outcomes for all women, right? And then there's specifically more studies that show improved outcomes for Black women. And our pilot at Elevate showed better outcomes overall, but it's a pilot, so it's a smaller group of people, and we're now finishing our larger research initiative. Rochelle.
I just want to add that Sharon and I have had the pleasure to present trauma-informed care trainings to OBGYNs and doctors and midwives in like clinics and hospitals around St. Louis and further, obviously.
Yeah.
We've been in Baltimore area.
They've been in group care, but I can't tell you how powerful advocates they are for themselves and for their community. I can't tell you how much those of us in the medical community have learned from them and how we need to adapt to better take care of Black women. I don't think I can ever pay you back, right, for your contributions. Invaluable, really, invaluable. Any other questions? With that, we'll wrap it up. Thank you so much. Thank you, Kirk and Missouri Health Net, for your support of group prenatal care. Thank you. Have a great day. Happy Friday.